Welcome everyone, and thank you for joining us for today's webinar, celebrating the 25th anniversary of National Infant Immunization Week. My name is Kathleen Amos and I work at the Public Health Foundation. I am joined by my colleague Russ Rubin, and we are pleased to be hosting this webinar on behalf of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, or CDC. We have three excellent presenters with us for this webinar and are very much looking forward to sharing their presentations with you. As we get started, we would like to take a minute to go over just a few housekeeping items for this webinar. On the slide, you can see an image of the attendee control panel, which you should also see on the right side of your computer screen. This control panel is your hub for interacting with the webinar. First, in the control panel, you should see an audio section. You have two options for accessing audio for this webinar: listening through your computer speakers or calling in on a phone. If you are using your computer speakers, please choose the computer audio option. If you are using your phone, please choose the phone call option and enter your audio PIN, which can be found in the audio panel. Please make sure to select the audio option you are using, and if you choose to listen over the phone, please also be sure to mute your computer speakers to reduce any echoing. Regardless of which option you choose, all webinar attendees are muted. The slides for today's presentation are available for download in the handout section of the control panel if you would like to have a copy. Links included in the slides are not live during the webinar presentation itself, but there are some links that are live in that handout. So if you download the copy of the slides, those links will take you to those additional resources. Throughout the webinar, please submit your questions or comments for any of the presenters via the questions box in your control panel. Please feel free to send in your questions at any time, and we will address as many as possible during the Q&A session at the end of the webinar. If you have difficulty with any of the technology for the webinar, please also use the questions box to send us a message, and we will help troubleshoot. And finally, this webinar is being recorded, and the archive will be available following the webinar to you and to others who are unable to join us today. So as you may know, this year marks the 25th anniversary of National Infant Immunization Week. From April 27th to May 4th, 2019, National Infant Immunization Week will highlight the importance of protecting infants from vaccine-preventable diseases and will celebrate the achievements of immunization programs in promoting healthy communities throughout the United States. During this planning webinar, you will learn about National Infant Immunization Week planning tools, digital communication resources, and CDC activities that are planned for the week. To share this information, we are joined by our first speaker, Jenny Mullen, Health Communications Specialist with the National Center for Immunization and Respiratory Diseases, NCIRD, at CDC. Jenny is the lead for Childhood Immunization Communications at CDC's NCIRD. In this role, she helps lead efforts to develop research-based messages and materials and to conduct communications activities that raise awareness among parents and healthcare professionals about the importance of vaccinating children according to CDC's recommended immunization schedule. Prior to joining NCIRD in 2012, Jenny worked at CDC's Injury Center, at CDC's National Center for Health Marketing, and at private sector communications firms. Jenny holds a BA in English from Oberlin College and an MPH in Health Behavior and Health Education from the University of North Carolina at Chapel Hill. In addition, we are joined by two speakers from Immunize Nevada who will share lessons learned from their experience building community partnerships to support infant immunization during National Infant Immunization Week and throughout the year. Lily Davalos is the Outreach Manager for Immunize Nevada. Lily joined the Immunize Nevada team in 2016 as a graduate intern and worked on various projects, including implementation of an adult immunization grant and community resource development. In her current role as Outreach Manager, she manages community outreach, supervises student interns and volunteers, and oversees collaboration with many statewide partners. Lily earned her bachelor's degree in biology and Master of Public Health from the University of Nevada, Reno. David Perez is a Communication and Outreach Project Coordinator at Immunize Nevada in the Las Vegas office. Prior to his current position, David held internships at the Nevada Department of Agriculture and the University of Nevada School of Medicine. David graduated from the University of Nevada, Reno in 2015 with a BA in Journalism and Public Relations. Before we dive into their presentations, we have a couple of quick polls to help us all get to know a little about you who are in the audience today. So I'm going to turn it over to Russ to take us through those.
Thank you, Kathleen. Before we jump into the presentation, we would just like to take 2 minutes for a quick poll to learn about you, our audience, and find out who is joining us today. We have 2 questions that will help our speakers tailor their presentations and comments accordingly. All right, all eyes on the screen. It'll reformat quickly. Okay, the first question is, how many years have you personally been involved in NIIW activities? Please make your selection and submit your answer. Okay, just a couple more seconds. Thanks everybody for voting quickly. I will close the poll and show you the results. We have many new partners joining us this year. Thank you so much for being here. Our second poll question is loading in a moment. The poll question is, what is your main job? Go ahead and please select the answer that best describes your job role. Vote now. Okay, last chance for responses. I will close the poll and share the results with you. Looks like we have many immunization program and coalition staff members with us today, healthcare professionals and health educators. Thank you so much for your participation. I look forward to seeing your questions later on in the presentation during the Q&A portion, and we'll throw it back to Kathleen.
Great, and thank you. I'll echo Russ's thank you. Thank you so much for that feedback. We are now going to turn the floor over to Jenny to get us started with the presentation. Jenny, it's all yours.
Great. Just going to advance here to the next slide. Okay, there we go. I think my first slide should be up. So first of all, I just wanted to say thanks so much to everyone for joining today. I'm really excited to be able to join you and talk about plans for National Infant Immunization Week, or NIIW, and hopefully the resources and materials that I highlight today will hopefully get many of you started planning your activities for this year's observance at the end of April. And you know, those of you, it sounds like we have a lot of people on the line today who maybe are involved for the first time. So that's great. We are here to help you get started, orient you, and let you know the pieces we already have that should be easy to pick up and start using from the beginning. So I just want to start off by just orienting people that National Infant Immunization Week this year is going to be April 27th through May 4th. And I'll just briefly go over the learning objectives. By the end of this webinar, participants should be able to describe childhood immunization rates and challenges, access NIIW planning resources, including the digital toolkit, identify new NIIW partners and describe how to engage them, and describe how Immunize Nevada has built community partnerships. So knowing that there are kind of a mix of folks on the call today, some people that are new to this week and some that have been involved for quite a while, I'll just give some very brief background about National Infant Immunization Week. As Kathleen had mentioned in the intro, this is actually the 25th anniversary of NIIW. NIIW began in 1994 at a time when we were experiencing as a country declining vaccination rates. There were several large measles outbreaks ongoing. And since that first year, local and state health departments, immunization partners, community leaders, healthcare professionals, and many others have all continued to work together each year to focus on the importance of infant immunization and to ensure we maintain high coverage. Actually, I think my slide may have just advanced on its own. Okay, I went try to go back. Hopefully you should see the NIW 25 years old slide up now. Sorry for that technical difficulty. I just want to say one more thing about before I leave this slide, which is that this week is traditionally really a great opportunity to celebrate achievements that communities experience around maintaining high rates of immunization. And it's also a great time to strengthen relationships with partners, volunteers, and champions, and to promote infant immunization for children ages 0 to 2 years old. So really focus on those infant series. And this photo here is just a picture of our CDC National Center for Immunization and Respiratory Diseases Director, Dr. Nancy Messonnier, participating at an NIIW event that was held in Nevada last year. And you can see here on this slide the logo for NIIW. So those of you who have worked on NIIW before in the past may recognize when you see this that we have updated the logo this year to reflect the 25th anniversary. But the same sort of theme is pulled through even in this new logo of showing a mother protecting her baby, which is really kind of the central point around immunization, that parents are choosing to protect their children. And that's really the basis of their decisions to choose to immunize on schedule. One of the most important things that I want to mention about NIIW is that obviously no one is really going to be able to solve all of the barriers and challenges that we face related to infant immunization in just 1 week of activities. It really takes a lot of hard work throughout the year from a broad range of different partners to keep kids vaccinated and keep them on schedule throughout the year. So I did want to say that the programs and partners that have really had the greatest successes with NIIW are those that have used this event as a way to take a longer term view. So I would really encourage everyone on this call, as you begin thinking about your NIIW activities, to start by taking a step back and assessing your community's barriers and needs around infant immunization, identifying long-term communication strategies to help address those areas, and then find some tactics that you can implement during this week of NIIW that will help move you forward towards those bigger, longer-term goals. So I did want to say that while CDC does observe NIIW at the national level, NIIW is really ultimately a locally driven effort. And each year, communities across the country choose activities and focus areas based on their local goals and needs. And sorry, my slides seem to keep advancing on their own. I apologize about that. So on this slide that's labeled NIIW Objectives, I just listed out some of the objectives that immunization programs and partners have often chosen to address during NIIW to give you an idea. And those include educating pregnant women, parents, and caregivers about the importance of infant immunization, increasing public awareness about the importance of infant immunization, recognizing partners and volunteers for their efforts in helping to immunize children, educating healthcare professionals about how to talk productively with parents about vaccines, engaging new partners, strengthening existing partnerships, and re-energizing or launching year-round efforts. So now we're on the slide about immunization coverage, and CDC does track childhood immunization coverage through our annual National Immunization Survey. And when we look at the data from that survey, we see that the good news is that childhood rates have consistently remained high and stable. But we do face some challenges. When we look at our most recent data from 2017, for example, we see that vaccination rates are lower in more rural areas and among uninsured or Medicaid-insured children. And these disparities are really larger for vaccines that require a booster dose in that second year of life. So, for example, DTaP, Hib, and PCV. And CDC is working to identify reasons for these disparities and evidence-based interventions that could be applied. But this is a disparity that we have started to see in these children. I also wanted to highlight another challenge, which is that a small but increasing proportion of children appear to be receiving no vaccines at all. When we look at children born in 2015, it appears that 1.3% of children are receiving no vaccines compared to 0.9% for children that were born in 2011. And while we don't yet fully understand the reasons for why these children, this percentage of children who receive no vaccines is increasing, we suspect that this may actually have something to do with difficulty accessing vaccines, since we do see that unvaccinated children in this NIS survey were disproportionately children who are uninsured. This slide just shows how childhood immunization rates have remained really quite stable since 2011, although there is some variation when we look at individual vaccines in the schedule. And then this slide shows the increase in children receiving no vaccines that I just mentioned a moment ago. And as we can see from this slide, there are very few children that are not receiving any vaccines at all. This percentage has remained below 1% for many, many years, although we did see this small increase in 2017 to 1.3% of children. And the reason I share this graph is I really want to explain that even though there is a lot of discussion about parents choosing not to vaccinate their children, the good news is that overall we see nationally when we look at the data that very few parents are choosing not to vaccinate at all. And most children are up to date on their vaccines by age 35 months. A lot of our efforts over the years have focused on parents of children who are very young, and we do need to continue this important work. However, I did want to highlight on today's webinar that over the past few years, data have also been coming out that suggest it's also critical to communicate with parents during pregnancy. In many cases, by the time a woman has given birth, she has already decided whether she will vaccinate her baby on schedule or not. So it may be too late if we wait until well child visits to begin educating parents about the importance of on-time immunization. And one example of this data is a longitudinal study of first-time expectant moms, which CDC conducted from 2014 to 2016. And in this study, we followed a panel of 200 women from their second trimester of pregnancy until their child was 19 months old. And as we can see here, the initial survey showed that over 85% of women had already made a plan for vaccinating their baby by their second trimester. More than half, or 63.5%, said their OBGYN had not given them any information about childhood vaccines. And their number one information source was actually online searching. Very few of these women, only 36.5%, reported that they were satisfied or very satisfied with their current level of knowledge about childhood vaccines. So, in other words, this tells us that pregnant women want information on this topic and they're making decisions about whether to follow the recommended schedule or not. But they're not necessarily receiving information from healthcare professionals to use in those decisions. NIW is a great opportunity to be building partnerships to help reach pregnant women with immunization messages. And we really need to be doing more work with prenatal healthcare professionals. We can encourage healthcare professionals working with pregnant women to refer pregnant women to credible sources of vaccine information, including credible websites. Prenatal care providers can also encourage women to meet with pediatricians during pregnancy so they can get all those vaccine questions answered. Every 2 years, CDC conducts a national online poll of parents. And this slide shares some of the key findings from our most recent poll, which was actually fielded last summer. We find that most parents, 92%, think that vaccine-preventable diseases are somewhat or very serious. Most, or 90%, think vaccines are somewhat or very important for keeping children healthy. But at the same time, we see that 15% of parents report that in general, they are somewhat or very hesitant about childhood vaccines. And we see from this data that a small but an important percentage are actively planning to delay at least one vaccine in the future. For example, we see that 8% report they are not vaccinating according to the recommended schedule. 13% report that they plan to delay at least one vaccine in the future. And the most common vaccines they plan to delay are flu, varicella, MMR, Hep B, and HPV. And of course, none of those are probably big surprises to those of us who have worked in this field for a while. And 62% somewhat or strongly agree that it's okay for parents to delay vaccines as long as they stay within the CDC schedule. So I think what all of this data really tells us when we look at it all together is that NIIW is more important than ever for educating parents and pregnant women about the importance of on-time vaccination. Because even though we see that coverage rates are high, many parents do still have questions and concerns. So I know that for many of you, this may not be your first time planning NIW, so I'm going to start by sharing some information about activities that CDC is planning that you can get involved with, and also highlight some new resources we have for you to use this year. So, while I said earlier, NIW is really a local effort, CDC will be conducting communication activities at the national level as well to help support states and local efforts with messages about the value and benefits of childhood vaccination. And these efforts include sharing messages through CDC social media channels, which I have listed here on this slide. And please do share and retweet these messages. And we're encouraging everyone to use the hashtag #IVaxToProtect during NIW. We will also be hosting a Twitter storm using this hashtag on April 30th from 7 to 9 p.m. Eastern. And this is actually an evening time frame, as you may notice. It's the first time we've done this event in the evening, but we're hoping that by this evening time frame that we may catch moms later in the day after work, or maybe after their children have gone to bed, depending on what time zone that they live in. And since this is later in the day, I do want to encourage anyone who'd like to participate that if you choose to schedule your tweets in advance, that is totally acceptable. That may make it easier for some people to be part of this event. So feel free to schedule if you'd like. Also, for the first time this year, we're going to be hosting an Instagram Q&A. Excuse me here, my slides are moving along. We will be hosting an Instagram Q&A event on May 2nd from 12 o'clock to 2 o'clock Eastern time. And in case you are not familiar with this tactic, essentially CDC will be posting a sticker on our Instagram account during that time frame, inviting parents to ask questions about immunization, and then CDC will answer them. So this is something that you can promote to your parent followers, that this is something that they may want to participate in. We will also be focusing on promoting our new 3-part animated video series called How Vaccines Work. It's a series of 3 short 60-second videos that follow baby Jack and his family as they learn about vaccines and the importance of on-time immunization. We've already launched the first 2 videos in this series, and then the 3rd video actually comes out next week. And we will be promoting the entire series during the week of NIW. On our website, we'll also be recognizing the recipients of the 2019 CDC Childhood Immunization Champions Awards by posting profiles and photos of each award recipient. And we encourage you to read these stories and share them to inspire others with the great work that these individuals are doing. And of course, we'll also be collaborating with national partners to share immunization messages during the week. I'm going to highlight several resources that are available for you to use during NIW, but I want to say we really have a lot of stuff to offer, and I'm not going to be able to go over everything today. So I encourage you to go back and visit the URLs that are listed at the bottom of these slides. Many of the resources that I'm going to highlight are actually available through the NIW website, and this slide here just shows the URL and the homepage. For those of you who are newer to NIW, we have got a lot of fantastic planning resources and templates on the website, and these can help you conduct a needs assessment, identify potential partnerships, and plan and evaluate activities. In the promotional materials section of our site, we have resources to help you promote NIW and events and activities that you hold during that week, including this year's digital toolkit, which I'll talk about in more detail in just a moment. You can also find sample key messages to use during NIW, our updated logo files. There's also letterhead and an NIIW certificate that you can use to thank volunteers. A toolkit for pitching your local media. There's signage that you can download. You can add your logo to it and print it for use at different events. And there are coloring sheets that you can print and distribute to children during community events. So I mentioned earlier the digital toolkit, and this is a piece that will be up in probably just a couple of days. We hope to have it up for today's webinar, but ran into a couple of glitches, but it should be up, like within the next day or two. But this is a resource you will definitely want to go and check out. It contains details about all of our digital events, such as the Twitter Storm and the Instagram Q&A that I just mentioned. From here, you can also access sample social media content, graphics that are sized for sharing over social media, and links to a wide variety of materials that you can share with parents, including infographics and listicles. And this year, the digital toolkit will also include a number of Spanish language resources as well, including Spanish social content and graphics for social media. Under the Educational Resources section of the site, you can find materials to use with professional audiences, including healthcare or childcare professionals, and also you can find resources to share with parent audiences. One piece I wanted to highlight is a piece available under Resources for Professionals, and this is a slide deck called Childhood Immunization Update. And this is something that we launched last year during NIW, and it's going to be updated and posted shortly. But basically, we created this because every year during NIW, a lot of organizations hold training events for healthcare professionals in their communities. And this slide deck is designed to be used in these kinds of settings. It includes topics such as the latest national coverage data, recent outbreaks of vaccine-preventable diseases, research findings about communicating with parents, and also materials that healthcare professionals can use in their conversations with parents. This slide deck is designed really as a template, so you can download it, you can drop it into your own organizational PowerPoint template, add your logo, you can edit it and customize it as you'd like. And as I mentioned, this will be available updated in just a couple of weeks. If you are interested in it, feel free to send me an email and I will alert you to when it's posted to our site. My email address is jjk7@cdc.gov, and I'll just say that again, jjk7@cdc.gov, and it's also listed on my final slide as well. CDC also has 2 online videos that may be of interest to healthcare professionals in your community. The first is a Medscape commentary about how to have productive vaccine conversations with parents, featuring Dr. Nancy Messonnier, who is the director of CDC's National Center for Immunization and Respiratory Diseases. And the second is a recording from a webinar that features a pediatrician and a family practitioner talking about strategies that they use to address vaccine hesitancy when they're talking to parents. And both of these would be great resources to share with providers in your community during NIW. I also want to highlight another customizable presentation that's available, and this is called 10 Ways to Create a Culture of Immunization Within Our Pediatric Practice. And we developed this presentation, really with the recognition that in a pediatric practice, all of the staff, including the non-clinical staff, play an important role in supporting parents in their vaccine decisions. So this is really designed as a presentation that a physician or a vaccine coordinator could give during a staff meeting or maybe during a lunch and learn presentation. And it's designed to help get everyone in the practice on the same page, sharing consistent messages about the importance of vaccinating on schedule. And you can download this, again, put it into your own organizational template, add a logo, and it can be customized with practice-specific information. And a great activity for providers to do during NIW would be to, plan to deliver one of these presentations to their staff. I also wanted to highlight 2 resources that we recently updated called Talking with Parents About Vaccines for Infants and Preparing for Questions That Parents May Ask About Vaccines. And these are both HTML fact sheets, which are also available to be downloaded as PDF. And they give step-by-step guidance for how providers can structure a vaccine conversation and how to answer common questions from parents. And these are part of a wider suite of resources we have available that's called Provider Resources for Vaccine Conversations with Parents, which CDC develops together with the American Academy of Pediatrics and the American Academy of Family Physicians. And these, again, are also great resources to share during any healthcare professional outreach that you may do during NIW. We also have many resources that you can share with parents and pregnant women. We've got fact sheets, videos, infographics, listicles, and really a lot more. And I encourage you to visit the URL on this slide to access our whole family of materials for parents and pregnant women. So I mentioned earlier our new animated video series called How Vaccines Work. This is a series of 3 short videos, and they can be embedded on your website or shared over social media. And we appreciate having your support promoting these and sharing them with parents and pregnant women. We also have posters you can order for free. These are available from our warehouse, and these are really a nice piece to distribute to your community partners. I do encourage anyone who would like to use these during NIW to go ahead and place your order now, just to make sure that those materials have a chance to arrive in time. And I'm not going to go over the steps for ordering in detail now, but I did list them out here on the slide so you can refer back to them later. We also have several materials available in Spanish. We've got a listicle, an infographic, we have a infant immunization frequently asked questions document, web feature articles, and you can find all of these at the URL that's listed here on this slide. CDC also has immunization resources specifically designed for pregnant women. And while these pieces here focus primarily on the importance of maternal vaccination to protect against whooping cough and flu, these pieces also do talk about how this protection can be passed on to babies. And if women get vaccinated during pregnancy, we do hope that they'll also be more likely to vaccinate their babies. So by now, I know that you may be wondering about maybe some specific ideas about how you can get involved with NIW in your state or in your community. And you can help support NIW specifically in the digital space. Our team has a few ideas to share with you, but you may have additional creative ideas, based on your own local communities. But some ideas are that you can participate in the iVax to Protect Twitter storm. You can also participate or invite parents to participate in the Instagram Q&A. You can share and retweet CDC social media messages. You can also post your own NIIW messages on social media using the iVax to Protect hashtag and the NIIW graphics, which will be available in the digital toolkit. You can invite your social media followers to share why infant vaccination matters to them using the hashtag #IVaxToProtect. And you can share CDC listicles, infographics, and other digital materials on your social media channels. You can also post an NIIW web button or banner on your website. And I just want to mention, excuse me. I did also want to mention that NIW can be big or it can be small, and you just need to work within your own time and your budget constraints. But regardless of how many resources you have to bring to this particular project, now is really a great time to begin planning activities that will be doable for your organization. Some more ideas about how you can get involved outside of digital activities. You can make plans to recognize the recipient of your state's CDC Childhood Immunization Champion Award. And you can do this on your website by offering that individual to media for interviews or even by holding an award ceremony. You can promote NIW through community events like health fairs or community baby showers, host trainings or presentations for local healthcare professionals, And we really encourage you to think of ways to train not only physicians, but also nurses and medical assistants. You can ask local officials to make an NIIW proclamation. And it's also a great time to engage new partners. And the presentation that you'll hear in a moment from Immunize Nevada will give you some great ideas about new types of partners to consider. While every NIIW celebration is really unique and different, a common theme is that it's a great opportunity for building and strengthening partnerships. So if there's a group that you've always wanted to work with, this planning period before NIW is a great time to reach out to that group, invite them to do something with you for NIW, such as maybe hold an event together or distribute materials or co-author an op-ed. And many traditional NIW partners have included healthcare professionals, public health departments, coalitions, and medical assistants. But you can also consider other types of community-based partners as well. And there are several ideas listed here, such as partners that you may be able to work with to reach parents or pregnant women. And partnerships, like anything in NIW, can be big activities or they can be small. And partnerships also don't necessarily require funding. It's a really great idea to look into organizations that you'd like to partner with and think about things that they can potentially do for you, which we call asks. And we recommend not only thinking about asks for events in the near future, but also think about longer term, how your activities can grow with a group over time. And this slide just lists, some examples of partner asks, and they range from small to medium to bigger asks. These are just to give you a few examples of ideas of many different things that partners can contribute to making NIW a success. So, for example, a relatively small thing to ask a partner to do might be to share NIW messages over their social media channel, or to promote infant immunization in their newsletter. And a slightly more difficult ask for a partner might be asking them to distribute educational materials about the benefits of vaccination to pregnant women that they reach through their program activities. And then a much bigger activity you could ask a partner to do might be hosting an event for NIW, such as a training for healthcare professionals on effective communication with parents about vaccines, or maybe holding a press conference about NIW and the benefits of immunization. So, there's a range of ways that you can work with partners, and you can sort of start small and build up from there, just depending on how your missions align with a potential group. To help you get started, we have created a guide to building partnerships, which can be found at the URL on this slide. And this guide helps you identify the right partners by giving you ideas for who to partner with, criteria for evaluating what makes a good partner, helps you identify barriers that could make a partnership difficult, and gives you tips for working with partners, such as how to create a work plan, tips for assessing and strengthening partnerships, and evaluating partnerships. But whatever you do decide to do, and whatever groups you're able to forge relationships with through your work on NIW, I do encourage everyone to tell us what you're planning to do during NIW. On the NIW homepage, there's a link that you can find where you can fill out a short web form, and this will just be a way to let us know about your activities. And then on the website, you can also go back and read activities that were submitted in past years to get additional ideas. And that is the end of my presentation. So I just want to thank you so much for your time today. I hope these CDC tools and resources are going to be helpful to you in planning your activities. My email address is listed here on this slide. And please do feel free to contact me if you have any questions, if you'd like to know when our template slide deck is up and available for Grand Round events, or if there's just anything else that I can help you with. So now I will just wrap it up there, and I'm going to go ahead and turn it over to Lily and David.
Thank you, Jenny. We are with Immunize Nevada. We're very happy to speak with everyone here today. So real quick, a little bit about us. My name is Lily Davalos, and I am the Outreach Manager for Immunize Nevada. We are a statewide organization. We have an office in Las Vegas and Reno, and I'm based out of the Reno office.
And good morning and good afternoon, everyone. It's really exciting to see a whole bunch of new partners on the line. My name is David Perez. I work out of the Las Vegas Immunize Nevada office. And just a little bit of a fun fact about us is Lily is actually from Vegas and lives in Reno currently, and vice versa. I'm actually from Reno and I live in Vegas. And like mentioned before, we both attended the University of Nevada, Reno. So a little bit about Immunize Nevada. I'm just going to wait for the slide to show up there, is that we are a statewide nonprofit coalition, and we're made up of diverse individuals and businesses and community organizations. We're committed to promoting health and preventing disease across the state of Nevada. So even though we specifically focus on immunizations, our entire coalition is made up of different public health key stakeholders, and we try to help each other reach each other's goals as much as we can.
All right, so before we dive into our specific National Infant Immunization Week activities, we like to share on how we engage with our partners year-round. First up is to lead with the why. Oftentimes we reach out to either health-related organizations or organizations who are not working in health. And either way, we like to explain, why immunizations are important, why infant immunizations are valuable, and how we could all benefit. And in that way, we could find common ground and build upon our similarities and interests. Additionally, we work really hard to connect with new and established partners. Immunize Nevada has been around since 1995, and in these 24 years, we've been very fortunate enough to have very strong partnerships throughout, and they include local health departments, community health nurses who are out in the rural communities, as well as local coalitions who are valuable resources in the communities that they live in. Additionally, we work with our partners to work on various projects and activities, and when we collaborate together, we do allow them to have control over certain aspects of those projects, and in that way, we make sure that we follow up and that we have clear action items and know who is contributing what towards a project. And lastly, we're also very transparent in our efforts. We consistently share any updates, any relevant progress and such. And additionally, we find that we benefit from this because if we are facing a significant challenge or any barriers, we find that if we're open with our partners, oftentimes they have really great ideas about how to overcome it and move forward.
So we will also elaborate on the asks that we do specifically to our partners for our NIIW events, breaking them up also into easy, medium, and hard or difficult. The easy ones, having our partners share our NIIW posts on social media and then distributing our event flyers, which we will focus on in a little bit deeper in the presentation, making sure they distribute those flyers to their clients and the communities that they serve. And then the medium ask is having partners participate at the health fairs, whether they be vendors or exhibitors. We invite partners to attend planning meetings. That way they become key stakeholders in the events that we're planning. Working with local colleges and universities to recruit volunteers for the events. And that helps a lot, especially if your local college or university has a public health club. And then also asking student volunteers to create educational content or also being able to translate educational content that's also been created. But then diving into a little bit of the more difficult asks is having a partner host a baby shower event. Being a host site can take up a lot of resources and time, which is why it can take a little bit more time and be a little bit more difficult. Also being able to develop a sponsorship package. You want to be able to target some sponsors that can give you kind of the money that you're looking for, and then be able to create enticing sponsorship deals that they can go ahead and tie into your event. And then also developing a communication plan. You want to make sure that you give yourself enough time to really think strategically about what kind of social media messaging you want to push out, as well as also making it fit with a possible press release and then hopefully a media tour so you can get some attention before your event and then during your event.
All right, so our success of our community baby shower oftentimes lies on the engagement and the participation of our very wonderful statewide community partners. And here are just a few. So first up is local health districts. So just two in Nevada are the Southern Nevada Health District, that's based predominantly out of Las Vegas, and the Washoe County Health District that operates out of Reno. Next up are local nonprofits who provide really valuable resources for families. The ones that we have worked with in the past include organizations such as Car Seats for Christy that provide free baby seats for low-income families. We also reach out to vendors who have resources for infants, and as part of our baby shower efforts, we like to expand on the topic of infants. So we don't just emphasize the importance of immunizations, we also reach out into other topics for infant health and safety. And previously, we have worked with local diaper banks and emergency shelter organizations. We also work with elected officials who are a valuable resource as they could help us with promotion and sharing all of these event details with their constituents, as well as provide assistance with funding and locating event space if needed. We also reached out to local health plans, so managed care organizations, MCOs, and they, whenever they can, they do help us out with funding to help us offset the cost of hosting these events. And lastly, we reach out to community-focused organizations such as the Junior League of Las Vegas, who are just overall a really great group, and they have helped us not only with recruiting volunteers to help us with the event on the day of, but also donating toys and raffle prizes for the event attendees.
All right, so diving into our previous year 2018 NIIW baby shower events, if you look at that map on the right there, that is the entire state of Nevada. And Nevada is a pretty unique state in the sense that we have two urban cities, and then the rest of our communities are pretty much rural communities. So we have Las Vegas down in the south, and then we have Reno up in the northwest part of the state. So we try to create these baby shower events every single year in order to engage with the communities, both in urban and rural areas. And at the beginning of NIIW last year, we had an event in Pahrump, which is in the southern part of the state, about an hour and a half outside of Las Vegas, followed then by Gardnerville, which is up north, about an hour outside of Reno. And then we ended NIIW with our two big events in our most urban areas, which is Reno and Las Vegas. And again, it's a great way to engage with lots of different types of partners, and then also to reach the communities that our target audiences live in. And then diving in a little bit into the flyers that were created for these events, you can see the little duck there. We tried to create branding that would resonate with our target audience, which is the pregnant women, infants, or caretakers of infants. I'd also like to point out at the bottom of the flyers, you'll notice the logos of all of our partners and sponsors. So tying that back into your enticing sponsorship deals to make sure that they get promotion if they are giving you any type of money. And then also a little bit of background on the events is that for the flyer on the left with the Southern Nevada Health District, they have been actually celebrating NIIW for a while now and partnered with Immunize Nevada in the 2015 year to kind of increase turnout and create a bigger event. And then the one on the right is actually for Reno, and Reno celebrated their first community baby shower in 2017.
Okay, so in the first, as David mentioned, we hosted community baby showers in Pahrump and Gardnerville, and that was a first for us. And in 2018, we were able to go out into the rural communities to have an event of this size. And we've learned a lot in this process. Going into different communities that we personally don't live in does present its challenges, but at the end of it, and what's in reflection, we found a few things that really worked for us. One is to begin outreach in a timely manner. Oftentimes it does take time to coordinate first-time events, and it takes time to identify relevant community stakeholders. For us, we started this planning 4 months in advance, and that was a pretty good amount of time because it did take a little bit of an effort to identify the right event space, as well as getting the right people involved and marketing the event. And as we were moving the progress and the process of event planning along, it was important for us to identify clear deadlines. And deadlines for us included when we needed our advertising materials finalized, when we needed to start marketing it and reaching out to vendors, etc. And during this time, we also identified the best communication methods. Our partners communicated on different methods. Some preferred phone calls, other preferred emails, while others wanted regular face-to-face meetings, and we tried our best to accommodate for all of these communication preferences. And then here is the artwork that we did for our rural events. They look the same with the exception of the event date, location, the time, and we also have the relevant sponsors across the bottom. And this does really help with our event marketing and our branding. And we have, here is the list of some of the activities that we had at these baby shower events. Even though we had 4 throughout the state, all of them had similar activities. One is on-site immunizations. So our partners at local health departments and our community health nurses were on-site, ready to give out immunizations to infants. In some locations, they were also able to give out immunizations to the families and caregivers, which was an added bonus. We also had an infant-focused health fair. So essentially, think of the typical health fair where you had organizations or tabling, giving out resources. So we added that, and those organizations covered a wide variety of infant-related topics. We also had family-friendly activities such as coloring books. We had a really fun photo booth. As you could see in this picture, we had this fun little photo frame. There you have a nurse from Southern Nevada Health District, and she's giving an immunization to a stormtrooper. So that was really fun. We also had raffle drawings to incentivize more participation, and that was a way to encourage people to visit more booths. And we also gave out bingo sheets. I know some organizations refer to them as passports. So there are a half sheet of paper, and it's supposed to encourage everyone to visit all the booths, to talk to everyone and learn more about the resources they had to offer.
And so diving into event promotion and social media, really try to use your local community to your advantage. What we like to do is identify local baby-focused events in the area leading up to NIIW, seeing if we can get a spot there to become an exhibitor or a vendor, and then be able to hand out our flyer for the event that we have coming up to celebrate NIIW and what will be happening there. So like Lily mentioned before, we definitely talk about the vaccines that we will be offered as well as the partners who will be there. If you do get sponsors for any type of event, make sure that you highlight and thank them on social media. So making sure that you tag them. That way their followers can see how it is that that sponsor is getting involved with your event. Also use live channels such as the ones provided on Facebook and on Instagram to your advantage. You can broadcast live from your event and kind of let your audience know what's going on day of, and also use it to highlight your sponsors or your exhibitors and vendors. They can kind of introduce themselves and let people know what resources they're offering there at your event. Also make sure that you create Facebook event pages for all of your events and then tag your partners and vendors. Again, that way all of their viewers can see how they're participating in your NIIW event. And then again, make sure that you try to get a press release together, possibly 2 weeks before your event, so you can get media time to possibly get a crew out to you. And then also give yourself some time to put a media tour together. Hopefully you're able to get media before the event to invite community members to show up. And then you also want the media there day of so that the media can see what it is that you're doing.
Okay, so we are very lucky to engage with our partners year long, even outside of National Infant Immunization Week. And here are just a few of the partners that we engage with. I know we already touched upon a few of these, but it starts out with students. We work with state colleges, universities, as well as state medical schools. We benefit a lot from bringing them into the table. Oftentimes, we got some of our best and most creative ideas from students who have a fresh perspective on how to promote immunizations across the lifespan. Just kind of going through these. We also work with a local Boys and Girls Club. Oftentimes, they have events that they want us to go and speak on immunizations, and we happily do so. We also host our monthly community meetings. They happen the first Thursday of the month, and this is a really great time for us to bring all of our partners into the same room and share updates, share event information, as well as discuss any challenges that we may be facing. And at Immunize Nevada, we also break off into 4 committees. We have one on events, education, outreach, and advocacy, and these are very topic specific. We also provide consistent updates, not only through email, but also through social media. Oftentimes, these updates could be on local stories as well as national news, and share with our partners what's going on in the immunization world. We also provide opportunities to collaborate throughout the year. Oftentimes, we work with different organizations to promote immunizations wherever they're at. And lastly, we also share event data after the event. Our partners who work with these events oftentimes want to know the impact that they contributed and helped us achieve for an event.
And then finally, some lessons learned from partner engagement. First being to make sure that you really respect partner input. Sometimes partners may have different goals or competing goals, so making sure that you listen to them and make sure that overall you want to have a successful event while meeting as many of those goals as possible. In doing so, please make sure that you clarify action items and establish deadlines on those action items. That really helps the whole team move forward at the exact same time. And the best way to do that is to learn how partners best communicate, as Lily had mentioned earlier in the presentation. Some people like to text, others email, and some people like to call. So really just making sure that you see how it is that partners best communicate so that you can reach your event goal and success at the same time. And then also allow for flexibility. We all know that not everything goes according to plan. That's just the way that things are. So making sure that you give yourself enough time to kind of roll with the punches and be able to reset if you need to. And planning for flexibility gives you enough time to do that. And we just want to say that that's it. Thank you for everyone for listening in. Again, my name is David Perez, and then previously it was Lily Davalos. We have our emails and phone numbers up here, so you're more than welcome to email us or call us if you have questions about partner engagement or NIIW events. We really appreciate it. And then Kathleen, back to you in the Public Health Foundation.
Great, thank you, David, and thank you all for those fantastic presentations. I know we don't have a lot of time for Q&A, but we are going to try to squeeze in just a couple of questions before we get off the webinar today. So please do continue to send your questions and comments for any of the presenters through the questions box. To kick us off, Jenny, we have a question for you, specific question about hashtags. Will hashtag NIIW be used, or is hashtag #IVax2Protect just for the Twitter storm and Instagram Q&A? Can you give people a little bit of direction about that?
Oh, great question. Yeah, I imagine people are wondering that because in the past, a lot of groups have used hashtag NIIW during the week. And what I will say is that the only sort of official hashtag that we're promoting is the hashtag #IVax2Protect. But that said, groups are welcome to also add on the hashtag NIIW in addition on their tweets when they send them out. But the ones that we will be sort of tracking and promoting are IVax2Protect. So great question.
Great. Excellent, thank you. And Lily and David, quick question for you. Could you explain how you tie in immunizations with a baby shower event? How do you make that connection?
Did you want to take this one, Lily, or do you want me to hit on it?
I could elaborate on this one. So with baby showers, of course, it's more like you're expecting a new baby, and oftentimes we do our communication efforts go towards pregnant women and infants, and we also tie it in as this is part of an infant, like an infant overall health. And this is kind of, you know, what is necessary and what is best as we are welcoming new babies into the family.
Great, thank you. So with that, we'd like to thank you all once again. I realize we're close to the top of the hour for joining us for this very informative webinar. We hope you enjoyed it. As we mentioned at the beginning of the webinar, we have recorded it. The archive and the slides will be available on the Public Health Foundation's website as soon as we have that process. So a link to the archive will be emailed to you all as soon as that is available. And you will also be able to access the archive at any time from www.phf.org/immunization once it's posted online. In addition, from that page, you'll be able to access the slides as well as archives of other recent immunization webinars. Please also save the date for our next immunization webinar, which will be held on May 29th at 1 p.m. Eastern Time. And we'll focus on how pharmacists can help promote HPV vaccination. You can find the link to register in the handout copy of the slides if you've downloaded those, as well as at www.phf.org/immunization. And we will follow up by email with additional information about that webinar. And hope you can join us again then. So we will leave today's webinar open for the next few minutes. Please continue to share any questions you have, comments you have through the questions box, or feel free to reach out to us following the webinar at immunization@phf.org. Thank you all again and have a great rest of your day.